Welcome to the original American Warrior Radio Show. I'm your host, Garren, an Air Force veteran, retired legal advocate for veterans, founder of AVET Project, a VA accredited claims agent, and founder of AVET Appeals. If you or someone you know ever wore the uniform of the United States Army, Navy, Air Force, Marines, Coast Guard, National Guard or Reserves, or the Space Force, you've come to the right place. American Warrior Radio Show always efforts to bring you great information about VA benefits, news, notes, interviews, and current events for all issues, military and veteran related. Our background music here on American Warrior Radio Show is graciously provided by none other than Stephen Hobbs, combat vet and very talented mill hop artist. Let's get right into the heart of the matter. Welcome to another exciting episode of American Warrior Radio Show. We have got a special guest. He's a repeat guest because he has his own segment. None other than Dr. Scott Fairchild with Heal the Warrior, Heal the Country. How you doing, Doc?
Hey, it's so great to be back here again. I appreciate the opportunity. And we've got a lot of good stuff to share with our veterans today. Some new stuff that they may not have heard about, and I hadn't even heard about until a couple of days ago. So,
well, and you were sharing it before we went on air here, and I know you're going to be excited, but kind of the theme that we wanted to focus on is how those affected by post-traumatic stress disorder, be it a man or a woman, can learn to live with it, can learn to live a more productive life. So throwing that at you, first of all, let's back it up. Give the folks a little bit of your bio, Doc.
Oh, basically, I'm a psychologist that was on active duty for about 21 years. Became a psychologist about halfway through that, and have focused my practice primarily on treating individuals, primarily veterans and their families with post-traumatic stress disorder. Done a lot of other things too, aviation psychology, psychopharmacology, and all those crazy things. But my heart falls in the area of taking care of our fellow warriors.
Exactly. And not enough providers do that. So I'm very thankful that we have you out there here in Brevard County, but your reach is further than that because I know you even do some telehealth, don't you?
I do. And then, I've transitioned and sold the practice to Dr. Walden, Baytree Behavioral Health. And Baytree Behavioral Health is known as the premier provider for mental health for veterans and their families in Brevard County. We've got 93,000 veterans here. And I would venture to say that a good 90% of those need some help. Whether
it's PTSD and anxiety disorder, maybe depression, whatever it might be, we all need a little help. We need
absolutely. And when you go into the military, I use this analogy, and the guys kind of identify with it. You go into the military and you're all fired up and you're young buck and you're ready to rock and roll. And you're like a sponge that's just full of juice and ready to go. And unfortunately, what happens when you're in the military, I mean, not with intent or design, but, your body, your mind gets stressed and you're like a sponge. And that sponge is squeezed and squeezed and squeezed. And the juice starts to leave you. And, you're still taught, suck it up and drive on, keep going. And unfortunately, you get to the point where they wring you out and then they wring you a little bit more to get the last few drops. And sometimes, unfortunately, we say they throw you by the wayside.
And that's important to hit on that point, because while the service member is on active duty and they believe maybe their spouse has told them, maybe a coworker, maybe their pastor has said, we're noticing some change, especially since you came back from that deployment in your behavior, you should go get some help. They really need to. They need to get this addressed while on active duty.
That is correct.
Well-grounded claims post-duty, but it's really important to see somebody, not a cry out to help and certainly not malingering, but go get the diagnosis while you're on active duty, because the benefits that will be engaged once you leave service, your separating service, are going to be much easier to obtain than having to go to Dr. Fairchild and do his assessment. And you do a wonderful job. You've helped, countless vets. But isn't that important? If you have any—
Well, you're absolutely right, Garren. You are absolutely right, Garren. And, I didn't realize when I was on active duty, because we are all in the suck it up and drive on mode. So
of course,
I have nephews and friends who are in the military now, and I'm telling them, you don't necessarily have to go on your daytime active duty time, but before the clinic, or before early in the morning when the clinic opens, or later in the evening, so you're not missing your work and getting a bad work record. But get it documented. I personally did not realize that it's a very simple formula. You may know it, you may disagree with it, I don't know. But the simple formula that I found out was that when you retire, if an issue is mentioned or noted in your medical record more than 3 times, they'll consider it. Otherwise, it's not considered.
Acute and transitory. You didn't make
Yeah,
any complaints. And
exactly.
post-service, within that 1 year presumptive period, you separate in March of, let's say, this year. Well, within that 1 year till March of 2024, there's kind of a grace period. If you get a substantial chronic diagnosis, let's say post-traumatic stress disorder, the VA is likely going to recognize that it was a cause by your active service, and the effective date for payment is going to come into play. But what we're talking about is making sure you get a diagnosis and start the treatment, whether it's group therapy or, as you said, pharmacology, whatever it might be.
Sure.
So, Doc, share on your Heal the Warrior, Heal the Country, and there's a good reason why you came up with that title, because you believe that.
I do.
You're healing the country. How can people that have the diagnosis, maybe they're 70% service connected for post-traumatic stress disorder, how can they best function or learn to function better in everyday life with their activities of daily living, whether it's going to the store, driving, handling the stress that's out there? How give us some points.
That is so important. And we're going to step back just a second, and we're going to address the fact that, there are a lot of providers out there. There are a lot of providers out there who will say, well, we can heal PTSD. And, that's just not the case. I have not really genuinely seen any cases of PTSD that have been, quote, cured or healed. Now, we can learn to adjust. We can learn to improve our abilities. We can learn to be able to function better in our world with the symptoms of PTSD.
Does that mean go grab a bottle of whiskey?
No, I mean, there are so many people that learn to numb it, and they will numb it with drugs. They will numb it with alcohol, a form of a drug. They will numb it with sexuality. They'll numb it with spending. They'll numb it with gambling. They'll numb it with any type of distraction that they can grab onto to escape the pain. It's a way to escape the pain. And so those are not certainly the situations that we recommend. I just talked to one of my patients who's a homeless vet right now. I just talked to him last hour. And he said, Doc, he said, I wasted so much time going down that road. He said, I could have gone to medical school. I could have gone and done a whole bunch of things. But he said, I went down that road and I learned that that's not where I want to go. He said, I want to live a clean life. I want to live a healthy life. I want to do therapies and treatments that are going to make me better. And so that's what we're going to talk about today. Therapies and treatments that can make you better. So the most important thing is making that decision that I want to live a healthy, reduce as much stress, not stress-free. It's impossible in this world, but reduce the amount of stress as much as I can in my life. So starting off, I think the most important thing is to find an individual therapist. Find somebody that you can consult with, somebody you can pour your heart to, someone that's, phone a friend. I mean, somebody that you can call anytime, somebody that I frequently tell my vets, drop me a note, leave me a text, call me if you need to. I got your 6. You need to find somebody that's got your 6 that knows you. Yeah. I get a lot of folks that show up every 6 months or every 9 months or every year and a half in crisis. That's not effective therapy. You may know one airman I'm referring to, but anyway, you don't want to just show up in crisis. It takes hard work on a regular basis. So get an individual therapist. That's very important to do.
Can I make a comment here? If somebody wants to, if they recognize that their body isn't what they want it to be, they can start working out at home. They can start going to the gym. They can work on the physicality of it. How much more important is it that we work on our mind, our clarity, our cognition, our ability to function?
Body, mind, and soul, working on 3 aspects. If you think of it as a stool, it has 3 legs. If you take, you could add family, 4 legs, I guess, as well. If any one of those legs is short or missing, you're a wobbly. And that's it. You don't want to go through life wobbly. No. You want to be effective and interactive. The Army, the military now, we used to call it suck it up and drive on. I don't know about the other services, but the Army now calls it resiliency. And they have resiliency training, resiliency in your finances, resiliency in your personal interactions with your spouse and family, resiliency in your spiritual life, resiliency in your managing your mind. So I guess we're looking at things that are going to enhance your resiliency. Now, you say, okay, we have individual therapy. Sometimes you'll hear about the groups at the VA, and they have a variety of groups, but most folks, they consider it kind of war stories and a lot of crying and whining and being victims. And so we have a group that's been going on at Patriot Behavioral Health, surprisingly, for over 20 years.
Isn't that
it's amazing. I mean, I asked for a show of hands from folks if they were in the original group. There's still about 3 or 4 of them that are in the original group. I said, do you guys realize you've been coming to this group one Saturday a month, the third Saturday of each month, from 10:30 to 12 at Patriot Behavioral Health for the last 20 years? We've grown all together, So group therapy is beneficial. And quite honestly, I run that group, and every time I go to that group and run that group, I learn something that I wouldn't have known. I mean, whether it's, rare benefits, like, one guy came in and said, my daughter has something, and because of the fact that it's related to Agent Orange, she's passed away and she's eligible to be buried in a VA cemetery. Little things that you wouldn't realize, or benefits of free parking at the airport if you're 100%, things like that. So I learned something from these guys, and they spoon feed each other with good stuff. So that part is important. The group experience is good, and our group experience is a soft one. You're not forced to communicate. I even tell the person when they're coming the first time, it's free. Normally it's $35, but it's free just to check it out and see if they're comfortable with it. And then they can participate. So group is one thing, but then we also have to look at the brain, because it's involved in everything we do. And you wonder, well, how does our brain get messed up? So first of all, when we experience trauma, when we experience an overwhelming event, there are neurochemicals that flow throughout our body. And those neurochemicals are going to impact the brain. Certainly, if we have a traumatic brain injury, bonk, that's going to impact the brain. So the brain is going to be the central location that's responsible for the symptoms that we experience. It's really going to be the point that we're going to focus on. And so what do we do?
Science is going in the direction of defining and illustrating how the brain is affected by these conditions, right?
It's huge. It's huge. And just recently, I drove one of my veterans who'd been in Restrepo and lost 13 of his fellow service members there. I drove him down to Delray Beach to get a brain imaging. And my good friend Daniel Amen has always said, how do you know unless you look? You go to a cardiologist, he listens to your heart. You go to a podiatrist, and hopefully he looks at your feet. But you go to a psychiatrist, and they say, well, tell me your story. And so you tell him your story with a faulty brain. So it's a faulty story. And then he says, oh, try this, and medicines. And don't get me wrong, medications are important, but you need to know which ones and why you're using them. And usually medications and therapy together provide a far better outcome than either one.
We've got the therapy,
yes,
whether it's individual or group-based.
Correct.
That's one way to help the deal. Medications, effective medications, and those oftentimes, Doc, and you can correct me if I'm wrong, but they have to be administered, maybe increased in dosage, maybe switched to different medicines, but you get to that point where you have a little cocktail that seems effective for that person.
Perfect. And, I spoke with another veteran this afternoon who'd been at the VA for a year and a half, getting a variety of medications, and heavy medications like Seroquel, an antipsychotic that's supposed to control his anger and his anxiety. And, he really didn't need a sledgehammer. And so I brought him in to see Nola Trostman, our fantastic clinical nurse specialist, who works with psychotropic medications as well as is a family practitioner. And she said, why are you on this? And haven't they ever given you anything for sleep? And haven't they ever given you anything for your nightmares? And so, there's certain medicines like prazosin, which will help with nightmares. And he also had high blood pressure. It's a blood pressure med. I'm befuddled why he's been going to somebody for a year and a half, a psychiatrist who didn't give it to him. And so we got him off of that heavy hammer, got him on some decent sleep medications. And he said, already in 2 weeks, he's feeling so much better. And so it's good to know.
Before we started the segment, you were talking to me about a new therapy, a new regimen involving, what was it?
It's a vagal nerve stimulator. Now, we have EMDR that works in helping individuals with
what does that stand for? Those are just letters to me.
Sure. It's I'm going to give you the official title, and then I'm going to give you the title that's more appropriate that a 9-year-old boy gave me. The official title is Eye Movement Desensitization and Reprocessing. Okay, it's a long, wordy thing. And the 9-year-old, I think, more aptly described it after he went through it. He said, I don't know why they called it that. He said, I just call it the nightmare eraser. And I like that one. So we have EMDR, the nightmare eraser, which literally takes trauma and the emotions attached to it, memories and the negative emotions attached to it, and processes them through like the brain should have in reality. But normally, after a trauma, when these memories come up, they're too intense, and your defense mechanisms come right back in and push them down. So with EMDR, we're able to push you through that. With the eye movement, we're able to release the emotion and get the memory put away in a different part of your brain where when you think of it, it no longer has emotions. It doesn't involve emotions anymore. So EMDR is a great way to offload junk. I mean, it's cleaning the closet. It's getting it out. And here's the neat thing. Once you do it, it's done. It's done. It doesn't come back. And so that's a very successful way.
Well, you employ that method in your practice, and
we do
many years.
In addition to, at one point in time, we did some neurofeedback as well, which retrains, brain retraining. It retrains those cells to operate in different ways. When folks have traumatic brain injuries, we also see deficits in part of the brains that's a part of the brain that's not working hard enough. And so sometimes we give stimulant medications. Sometimes we do hyperbaric oxygen treatment, where basically you will sit in a chamber or a tent, preferably a chamber. And in that chamber, the oxygen levels are raised to a point, 1.1 atmospheres, 1.5 atmospheres, sometimes for wound healing, 2.5 atmospheres. It just increases the pressure. It's like diving in the ocean. If any of you are divers, the pressure is increased. And that oxygen permeates your body. It also permeates your brain cells. So it's amazing to see that those brain cells aren't really dead. They're just asleep. And they need a little slap here and there to wake them up. And they actually wake up. And if you go to the 22 Project and look at the way they do therapy, there's some that says what we do in therapy, you will see the brain imaging before and after the hyperbaric. It's amazing to see the difference. Now, you also ask about some of the newer things.
Yes.
The newer things. I met yesterday. I was able to connect with a person who's going to be involved in helping one of my vets. And ironically, this dude has started out as an Army medic and then got out. And when 9/11 came about, he went back in. So this dude has 31 years of active service. He's the advisor to the 1st Special Ops Command. He's a psychological advisor at Fort Liberty, formerly Fort Bragg. And I talked with him about some of the newest stuff. They've got kind of an unlimited budget, $4.2 million, to help those operators, to help those warriors. And he said, you go into the new facilities and they have exercise, like you said, and they have acupuncture and they have relaxation and they have brain stimulators. And I asked him what he thought about Alpha Stim. Alpha Stim we use in our office. It's very helpful for reducing anxiety, helpful with depression, and helpful with sleep issues and sleep problems. So he said he loves Alpha Stim. He farms it out to the operators, but he said he's got something new that he's going to send me a copy of the white paper that they're working with, and it's called a vagal nerve stimulator. We knew about the vagus nerve in your neck, which kind of records all of your trauma. And it's the nerve that stimulates the fight or flight response, the sympathetic nervous response.
Okay, how does this device work?
Well, we knew about the physician in Chicago, in Illinois. I went up and visited him. He does vagus nerve. I forgot what it's called, but he does a vagus nerve intervention where he goes in and stimulates it through surgery. And actually, it makes a difference in alleviating many of the PTSD symptoms. It's about 80% effective. It was on 60 Minutes. His was on 60 Minutes. Piqued my interest. I flew up, spent some time with him, learned about it. But now there's the development of a new piece of equipment that you place on your neck for a period of time, 20 minutes, 30 minutes. I'm not sure the actual time, but you place it on your neck. It stimulates the vagal nerve, and it actually wipes out a sympathetic nervous response. So say, for example, you experienced the death of a loved one, or the trauma in a car accident, or robbery, rape, assault, hurricane, tornado, car accident, and all of a sudden you're feeling the distress of what we would call an acute stress disorder, which is basically PTSD less than 30 in the first 30-day period. So you experience it then, and you're saying, "Oh, this is throwing me for a whirl." So you get one of those pieces of equipment, you put it on your neck on a daily basis, use it as therapy. What it does is it blocks the fight or flight response. In fact, in his words, he said, it smokes it. It smokes the sympathetic nervous response. Not only does it do that, they're now finding that it reduces the chemicals that cause the negative reaction to a traumatic brain injury, which is huge. So the only drawback,
non-invasive. This is
non-invasive. He has bought it for a number of his operators. They're using it, when they come back from an intense mission, where you go over to meet new people in other countries, then you kill them and come home. But the drawback on it now, and hopefully it'll come down over time, is each of these units costs about $9,000. Yeah. But eventually, when the Alpha Stim came out, it was like that as well. Excuse me. So, these are things on the horizon. He said right now, the VA, which is true, the VA, the Army, the military, Army, Navy, Air Force, Marines, they really don't have anything that treats TBI. They just bring you in and say, "Yep, you got it." There's not much that you can do. Some brain retraining, perhaps. So this is huge. This is huge for the traumatic brain injury, folks. I personally am a strong advocate for hyperbaric oxygen treatment. I've seen the results. Unfortunately, at this point, TRICARE, Medicare, the insurances don't cover it. But for those of you within listening distance, I met with the good Dr. Bouza from the hyperbaric chamber here in Melbourne on Hibiscus. And he's
retired. In Florida, people.
Florida people.
To you, if you're within Central Florida,
exactly,
this can be an opportunity.
He's retired and out in Washington, but he comes back once a month to check on his facility. They largely do wound healing in the chamber there. It helps wounds heal quicker with the high pressure oxygen. And they have so much of that. We used to do, quote, brain neuro dives, but there hardly was any room for it. Now, he was so kind. I love Dr. Bouza, that he saw me on August 1st. And he said, we need to start some neuro dives again. And so what he's going to do is he's basically going to do these neuro dives at 1.5 atmospheres. And he's going to do those 2 to 3 times a week for 2 hours. You can read, you can do whatever you want to do, use your computer, I think, or whatever inside the chamber, or read or talk to the other people, do group therapy. I don't know. But you can do that while you're in the chamber. And then he said, we'll know in a couple of weeks if it helps. The way we'll know is improved sleep, number one. Number two, the way we'll know is improved cognition, memory and concentration, short-term, long-term, intermediate term. It's very important to know that if you've had a traumatic brain injury or your brain's been arrested in some way biologically, the first symptoms one usually has is from the prefrontal cortex, from the temporal lobes of the brain, the front part of the temporal lobes, and it results in I call it short-term memory loss. You know, things where you look at a number and you look back and you say, what was that number? Or I joke about it and I say, when I get in the shower, I have to check the soap to see if it's wet to know if I used it or not. You know, or did I, there's probably a couple days a week that I shampoo my hair twice, you know, because of that short-term memory loss. And so I'm personally going to be participating in some hyperbaric here. And we're going to invite anybody who wants to participate, because Dr. Booza has been kind enough to say that he's going to do it for cost. So we got a chamber with 15 seats. And, you know, the more people we can put in there, we divide the cost, the less of a cost is.
Right.
Now,
And it doesn't happen overnight. You need to go through repeated.
Sure.
The regimen involves you going for dive after dive after dive. It doesn't happen overnight. But
up to 40 sessions, yeah.
40 sessions. So you do the math on it. It's quite an investment. But then again, people, what is your life worth? Yes, we need to go buy groceries. Why do we buy groceries? Because we have to have food. We have to have intake. Why do we drink water? Because it's required. Yeah. If your brain is scrambled from a TBI, or God forbid, something happened outside the realm of normal human experience, and you just can't get it out of your head, and your sleep's messed up, and you got hypervigilance and all the different signs and symptoms Doc has talked about in the past, what do you got to lose? You know, this is investing in yourself to heal you. And that's what we're talking about. We're talking about how to live with PTSD and the other mental illnesses, right?
Oh, absolutely. And you know, if you can't invest in your area, wherever you're located, in the hyperbaric chamber stuff work, granted, the general hyperbaric treatment is in a small one size, you know, like a twin size bed.
The one I've used, right?
Yeah, so folks have a little bit of claustrophobia with that. But you know, the big chambers, if you can't afford that, you know, get yourself down to the 22 Project. And again, the operative words there are free, free, and free.
Love that word.
Yeah, love it. And they've run through so many people through there. And the changes are generally pretty permanent. You know, it takes a while, but the changes are generally pretty permanent. There's one thing, Garren, you know, we haven't talked about. A couple of things, actually. Spirituality is one important thing. And family, you know, how do I survive with my family? I snap at them. I bark at them. Little things upset me, and I'm irritable all the time. And, you know, how do we deal with relationships? You know, PTSD severely impacts relationships. 15 years ago, I was sitting at a table with the director of the VA at a dinner in Washington, D.C. And, you know, he mentioned to me, he says, yeah, we really got to focus on, you know, the erectile dysfunction that's related to PTSD. And I'm like, say what? You know, how is this related to PTSD? And I'm not sure the VA still knows how it's related. I would surmise that when you've got increased irritability, you don't feel very lovey-dovey and sexual, you know? So if you're nasty and an old critter and crusty at your spouse, you know, time after time after time, it doesn't facilitate the love language there. And so after a while, also, it affects libido, and it affects erectile dysfunction, as do the many medications our veterans take for their physical illnesses. So that part,
trazodone being one that I just can't recommend for anybody.
Yeah.
Even though I'm not a doctor, as a practitioner, I see too many people on that drug and having way adverse effects to the point where they become impotent, and that's awful. To treat one and develop another disability, treat one disability and develop another. But you mentioned faith and you mentioned family. Obviously important to have somebody that you can lean on, whether it's a close relative or your spouse or even children. But they're also the victims of it, because if somebody's so affected by PTSD, as you said, the irritability and, you know, the anxiety, all those different things, it's going to affect the entire family in a bad way.
Absolutely. And, you know, there's a young man that's come out to our church and taught periodically. He works with the youth. He flies in from, I think, Beulah Baptist Church in North Carolina. Definitely a Baptist church if it's in Beulah. So, but anyway, Brian Burgess is amazing. If you go online, you can look him up, and he has a great presentation there. He's a big time weightlifter, and, you know, he wanted to be an Arnold Schwarzenegger and fell a little bit short, but maybe not. He runs his congregation up there, and he said something very important when we talk about faith. He did a presentation to our men's group on a Saturday morning not so long ago, and he's writing a book, and I'm just waiting for that darn thing to come out because I want to read it. He talked about us as men, especially. This applies more to men, but maybe to some women with PTSD as well. He said that, you go through life, and once he didn't say PTSD, but once you're traumatized, I often say that you want to be in your man cave or your woman cave. You don't want to be around people. They're not going to find you at aisle 7 on Walmart. They're not going to find you at Disney or Universal because you don't want to be around people. The reason for that is you get pissed off, you get irritated, and you avoid people because you want to avoid conflict, and so you isolate. And he said something, he said, especially about men, we're kind of suck it up and drive on people. And we don't have that many men that we actually associate. So I would challenge you out there in the audience listening. I would challenge you to, take a pen and write down, if you're a male or even a female, write down, hey, say, for example, that you were in a major accident and your life was threatened, and you had to notify 8 people. Who would those be? Well, okay, maybe your wife, maybe your kids, maybe your pastor. Okay, yeah. But how many more other people are available and on that list? He made a very good point in his book. I think it's going to be called something like Carried by 8. Okay. And carried by 8 kind of implies who's going to be your pallbearers, And so most men, I would say, cannot list 8 people that are that close to them. And so that's an important thing to develop, whether it be by faith or just in a secular way, is to start identifying people that you could really trust with your life, with taking care of your family if you weren't there. Carried by 8. I think that's so important. And he has a nice video about that, Brian Burgess, online. And
look him up, people. Share the information. Doc is telling you about it. The only way we push this forward is if you do share the information.
Exactly. So check it out. Listen to it. It's a very interesting. He's not a beat you over the head with the Bible kind of guy. He's a weightlifter, man, and he's a dude, and he can relate to young folks, and he's an excellent speaker. And I'm just waiting for that book to come out because I want to learn more about it.
We'll have to have him. We'll have to have him on the show. We're running late here, Doc, but let's cover some things here first. One thing that comes to my mind, particularly when it relates to stress and irritability, I'm driving and people are being idiots out on the road. You taught me a long time ago the breathing technique. You hear it in general ways. Oh, take a deep breath. But actually, you taught me breathe in deeply for 7.
Yep.
Hold for 4 and slowly exhale for 6. So I do 7, 4, 6 a lot. And what? It works.
It does work because it works on the brain. It slows down that vagus nerve response. It slows down your entire body, your circulation. It calms the brain. You heard the popular song, calm down, and that's what you got to do. You got to calm down. And only you, I think it was Smokey that said, only you can prevent forest fires, but only you can prevent brain fires. Okay. Only you can prevent brain fires. And, it may just be a kindling. And the kindling may be that guy that cuts you off on the road. But don't let that current kindling turn into a brain fire.
Exactly.
Don't let it do it. So,
exactly.
You have so much control over your body and your mind, your spirit, and reach out to people. Surround yourself with people who are supportive. At this point in my age, in my life, I unplug from people that are negativity. I don't, stay away from that. Connect with people who are supportive and understanding and lift you up. And that part is so important. So there,
properly diagnosed,
yes,
appropriate medication that is effective.
Yes,
practice breathing, get involved with family or church, or have some place to put those energies. Right?
Exercise, critical.
Exercise. Yep. You mentioned the bodybuilder, and then get with somebody like Dr. Fairchild that has such an exquisite understanding of this whole disease process, that he can help map out a future for you so that you can live a healthier, happier life, even though you're stricken with this lifelong illness called post-traumatic stress disorder. Does that kind of sum it up, Doc?
You betcha. And there are people out there that understand. Dr. Walden at the clinic, Dr. Eatman at the clinic, neuropsychologists, they understand trauma. Bill Nauman at the clinic used to work at the VA for 30 years. He understands it. Get with all these people, give us a call, 321-253-8887. That's Patriot.
The number will be scrolled on the screen so you can write it down and make that call. And as we always say about suicide, because this is September, Suicide Prevention Month.
It is.
Don't do it. Suicide is a permanent solution. No
to a short-term problem.
Temporary problem. This too shall pass. So with that, Doc, I want to thank you so much for really laying some good stuff on us in the audience here with Heal the Warrior, Heal the Country. And maybe one day we'll talk more about how you developed that theme, that title theme, because it is a very interesting story. And you've practiced it your whole life and you believe in that. That's a core part of who you are. You're an amazing man. Keep up the great work, sir. And I know we're going to have more from you on a future Heal the Warrior, Heal the Country episode. So thank you, Doc, for visiting us today. You got any final words?
It's been my pleasure. And thank you to you and Kim and the whole group from AVET Project. The interventions that you do are uplifting and life-changing, whether you're supporting military spouses, whether you're supporting military children, whether you're supporting the veterans themselves or the active duty folks. I go around the world and find people at every location that have been touched by the work you do. So we thank you for that. And it's always been my pleasure to be here. Thank you again.
Well, you are the best. And everybody out there, listen, I'm going to close this off with my usual tagline. Don't forget, thank AVET.
Hi everyone, it's Garren Cohn with American Warrior Radio. I'm here with my good friend Christian. We're here to deliver a very important message about a crisis in our land.
Suicide prevention, more specifically, veteran suicide prevention.
22 a day are taking their own lives. This must stop. This can't continue. If you or someone you know is contemplating suicide, please know that God has tomorrow planned for you. Don't take your own life. And just remember, suicide is a permanent solution
to a temporary problem.